Good evening, friends. I hope you all are doing well. So in the last episode, we talked about acute mountain sickness and high altitude cerebral edema. In this episode, we are going to discuss about high altitude pulmonary edema, that is HAPE, as we call it. So HAPE is mainly a lung problem and therefore is not necessarily preceded by an acute mountain sickness, that is AMS. HAPE develops within 2 to 4 days after the arrival at the high altitude, and rarely it occurs after 4 to 5 days at the same altitude, probably because of remodeling and adaptation. Now, coming to the risk factors of HAPE, number 1 is rapid rate of ascent. Number 2, history of previous attack of HAPE. Number 3, respiratory tract infections. Number 4, cold temperature, that is at high altitude, which is normal, and men are more susceptible than female. This is just a fact that is happening. Now, coming to the symptoms of HAPE. Number 1, reduction in exercise tolerance, that is the fatigability while you climb. Number 2, there is a dry persistent cough which may presage a HAPE and may be followed by a blood sputum production. Number 3, tachypnea, that is increased heart rate, increased respiratory rate. And number 4, that is tachycardia, that is increased heart rate. These are even at rest. Number 5, crackles may be heard on auscultation, but is not diagnostic. It's not a diagnostic. Number 5, HAPE may be accompanied by the signs of HACE, that is ataxia, increased sympathetic tone, that is dizziness, headache, and you will get anxious easily. Number 5, respiratory alkalosis and hypoxemia are persistent if someone is not taking acetazolamide. Now, coming to the management, immediate descent or evacuation is the key. Number 2, exertion should be minimum while the patient is kept warm. Number 3, administration of oxygen 4 to 6 liters per minute to bring the SpO2 to more than 90% in the patient. Number 4, adjunctive therapy with nifedipine may help. Number 5, hyperbaric therapy has to be given if descent is not possible. Number 6, drugs that decreases inflammation, like NSAIDs, like cyclophenac, diclofenac, or ibuprofen can be given. Number 7, salmeterol may be given, which clears the alveolar fluid that is accumulated in the lung while climbing to high altitude rapidly. Number 8, alpha blockers like phentolamine can be tried. But the most important is to avoid potent diuretics like furosemide. Remember this. Now, coming to a tip. Giardia parasite is very common at high altitude, so their cysts are not destroyed by hand sanitizers we use. So that is why you need at least 20 seconds of proper hand washing with soap and water. Otherwise, it can lead to giardiasis and you will, my friend, end up in diarrhea over there, which you don't want to, of course. Now, coming to other high altitude problems which we face. Number 1, sleeping impairment. If you have obstructive sleep apnea, that is OSA, you should use a CPAP device, which is recommended, along with acetazolamide, which will be, of course, of better help in OSA. Number 2, there are some gastrointestinal issues that might happen at high altitude, like giardiasis, which I told you earlier. Diarrhea, constipation. Number 3, high altitude cough is commonly due to inspiring dry cold air, whereas hypoxia and water loss plays a role. So you need to wear balaclava, and have to hydrate yourself properly. So coming to the Q&A part, but I'm cutting down direct to the answers only so that the length of this video is shorter. Number 1, patients with TIA are advised not to travel at least 3 months after their attack. Number 2, patients with aneurysm are strictly advised not to travel to high altitude because there is a risk of rupture of their aneurysm, which can lead to hemorrhagic or stroke attack at that air place. Number 3, patients with migraine, there are increased chances of them to suffer AMS at higher altitude. Number 4, patients with asthmatic patients, like cold air and exercise provokes acute bronchoconstriction, which can lead to asthmatic attacks. But it has been found that problems of asthma at higher altitude is less because there is less allergens and increased circulating catecholamines. But there are precautions to take their meds, glucocorticoids, and severely asthmatic patients are cautioned not to travel at higher altitude. Pregnant women can travel at high altitude, but not advised to travel more than 3,000 meters of height. Obese patients, obesity is a risk factor for acute mountain sickness, as I told in my previous video episode, and there are increased chances of nocturnal hypoxemia, and they may predispose to high altitude pulmonary edema at night because of this obstructive sleep apnea, which can lead to hypoxia. Simple. Now, sickle cell patients or sickle cell anemic patients are has to avoid travel to high altitude because it can lead to veno-occlusive crisis. But if someone has to travel, they must be supplemented with oxygen. Thalassemia patients have not been known to cause any problem at high altitude. Coming to diabetes mellitus patients, a well-controlled diabetes mellitus is not a contraindication, but proper eye examination is a must before going to a high altitude. Please carry your insulin pumps or medicines, ready-made sugar, chocolates, whatever you can, and take a proper glucometer. Also, remember not to take dexamethasone because there are increased chances you may worsen. Chronic lung disease patients, please take a proper pre-travel evaluation. And if there is a chance that the high altitude has PaO2 lesser than 50%, then you need a proper evaluation must. And if you have a pre-existing pulmonary hypertension, then you are advised not to go, and if you still have to go, please take proper nifedipine and medications. Patients with chronic kidney disease must avoid acetazolamide and can stay there for a shorter period at high altitude, but there are theoretical concerns that it can worsen acetazolamide. If your GFR is less than 10 milliliter per minute, you have to stop your acetazolamide, otherwise you will end up damaging your kidneys permanently, which can lead to end stage kidney disease. Okay, that's it for episode 2. We'll be coming in the next video with some different topic, and please let me know if any topic I can share with you in the comments. If you like this video, please raise a thumbs up. It will help me a lot. Thank you. Bye bye. Take care, and best of luck for your trip.